So we should get going. So,
I should start?
please.
I am starting. It's almost Boker Tov. Good afternoon. I'm Rabbi Bill Rudolph, co-chair of the Greater Washington Forum on Israeli-Arab Issues. We are pleased to co-sponsor this program with the mothership, the Interagency Task Force on Israeli-Arab Issues, based in New York. The two entities, the mothership and our little ship, share the common goal of learning and raising awareness about Israel's Arab citizens, the 21% that we spotlight in our programming. The coronavirus crisis has highlighted the existing disparities between Israel's Jewish and Arab citizens, mirrored, I must say, in many ways by the disparate suffering during the pandemic of Blacks and Latinos and those economically challenged here in the States. But the crisis in Israel has also illuminated the shared challenges that healthcare workers and community leaders face in keeping all of Israel's citizens safe and healthy. So it's my pleasure to turn the program over to Liron Shoham, Executive Director of the Task Force, who will moderate our program today. Liron.
Thank you. Thank you so much, Rabbi Rudolph. As we were saying before the call started, it's always a pleasure to partner with the Greater Washington Forum, who has been doing amazing work raising awareness and educating about these issues in the DC area. As you said so well, the task force is an organization serving the American Jewish community to educate and raise awareness about Arab citizens and Jewish-Arab relations in Israel as a key part of Israeli society. We are delighted to welcome everyone to the call today about the second wave of the coronavirus from the medical and community front lines. There are many dimensions of the impact of this pandemic on Arab society in Israel. In the first wave, Arab society had disproportionately low rates of infection, less than 6%, despite being nearly 21% of the population. And the role of Arab doctors, nurses, and paramedics on the front lines was widely lauded, underscoring the shared society opportunities embedded in a shared national crisis. At the same time, Arab society, already Israel's most economically disadvantaged population, has been hit hard by the parallel economic crisis, further challenging local leaders in managing the emergency response efforts on the ground. The second wave has unfortunately taken Israel from the country best managing the crisis to the one with the highest daily infections in the world, including an Arab society, where infection rates are roughly doubling every month. Today, Israel is in the midst of a nationwide lockdown, along with an ongoing political crisis. And the lockdown, it looks like it'll be extended for another several weeks at least. In this context, we're so grateful to have the opportunity to hear from leading figures at the heart of the two major fronts of the crisis in Arab society, the medical and community front lines. Dr. Fahed Hakim is the medical director of Nazareth Hospital, the largest medical facility in Arab society, and he serves on the Ministry of Health's Advisory Committee on the fight against the coronavirus, as well as other national health committees. Nidal Othman is the deputy mayor of Tamra, a city that was early in developing an effective local emergency response that was then turned into a model for other cities. Nidal continues to be on the forefront of the local health, social, and economic efforts and is advising other Arab communities on theirs. Thank you to both of you for taking time in this intense and hectic period to join us. We'll begin the discussion with as a moderated Q&A in which I'll ask the first set of questions and then open it up to participants. For everyone listening in, please feel free to submit your questions over chat as we go. You'll also have the opportunity to raise your hand and unmute when we open for discussion. So with no further ado, Dr. Hakim, please, can you please tell us a little bit, just take us into your world. Tell us about Nazareth Hospital and the impact of the coronavirus on the communities you serve, a little bit about the infection rates today and how you've adapted your operations to meet COVID-19 needs.
All right, thank you, Liron, thank you, Bill, and thank you, Nidal, for joining us and everyone. I'm happy to be joining you from Nazareth here this evening. You know, coronavirus hit everyone and hit the Arabic sector very hard. The Nazareth Hospital, actually, as Liron stated, is the largest hospital in the Arabic sector in Israel. It's actually one of the oldest hospitals in the area. It was actually incepted or established in 1861. So at 160 years serving the community here in the area, not just Arabs, Jews, and Christians, Muslims, everyone. And this time in this crisis, we actually took the lead of giving and caring for the Arabic sector as basically one of the main hospitals in the area. Today, as we look at what happens in Israel, and probably people look at it, the Arabic sector was in the first, as Liron stated, in the first wave, we were so good, so doing good. And now it's the opposite. When we got up to at least, almost 30% of the positive tests that were initiated in the country were coming from the Arabic sector. And that was a case when we had a very big gatherings, weddings here, people gathered all the way and didn't take the regulation of Ministry of Health and other regulations that were here. As for today, with the lockdown, we went down with the number of infected people. And actually we have today in Nazareth, almost 340 patients that are active. In our facility, we have 42 beds for coronavirus patients and 37 are occupied. It's a small facility. It's a 130 beds facility, but basically it's the largest here. And we serve almost more than 500,000 people. And people come to our facility from everywhere. We opened in the hospital 4 COVID-19 departments. That's almost all the hospital beds. And this is, with the help with Ministry of Health, with the help of even the Prime Minister office. So basically we were standing in front. I'm talking to you an hour after the Minister of Health just left the hospital, and the General Director of the Ministry of Health were here today to give support to the staff, to give support to the hospital, and to talk about what is going to be with the third wave. We're going probably to go through the winter that is coming forward. Our hospital established a biological ER that is like it's a small tent nearby the whole facility, and this tent or biological ER is the main ER in the area, as we call it, the red area. All this, cities around us, all the villages around us have very high numbers of COVID, and people come here to be tested as a drive-in, again, to be tested if they feel that they're sick, and to be tested if they're actually positive. So we have almost between 150 to 250 patients a day that come to our facility to be tested for COVID. For the time being, the numbers are lower in the Arabic sector. As for now, for today, we're talking about 11.1% of the whole numbers that the country is getting us are positive in the Arabic sector, and this is good. But relevantly here, we need to say that with all the holidays that we are into, there are less tests that are performed in the country. We still are coping today, as we know, with the Orthodox Jews that are now getting a 26.3% positive as for today. And that's the case today. We were accused, let's call it, the Arabic sector and the Orthodox Jews are the two sectors that are actually infecting the country. But as for today, it's less in the Arabic sector and more in the Orthodox Jewish area. That's
real quick, if you can speak a little bit about the community that you serve, and if you can say a few words about what you think kept the numbers low in the first wave and why the numbers, what has made it more challenging to keep numbers from going up, even if it's 11.1% today, it's double the 6% that it was before.
First of all, this is like just a number for today. I don't actually believe those numbers because we're not performing a lot of tests. So when 3 people tested, we'll have more numbers. We still have a lot of severe cases here. Out of the cases that we have, almost 80% of the cases are severe. We have people on ventilators. We have people that severe. Liron and others, the Arabic sector actually is a young sector in Israel. Basically, it's not more of adults. We know that the age of 65 and more, we have just 70,000 people in whole country that come from the Arabic sector. It's a small number, but basically we have non-healthy people, people that go around with at least 6 to 7 titles of diseases. You know, in the Arabic sector, between the age of 40 to age 65, people have more diabetes, more heart hypertension, more like liver problems, heart problems, kidney problems, obesity, and smoking problems. And all those predisposition basically for COVID are very heavy. So what we get in the department today, well, we serve almost all the population around, mostly Muslim population. In our hospital is a charity hospital, it's a Christian facility, but basically most of our workers are Christians, but we serve 95% non-Christian facility, Jewish, Christian, Muslims, Druze, and others. And basically it's a, you know, a mutual. Today, as we see, this virus doesn't see if you are wearing glasses or not. This virus jumps from place to place. It doesn't, find its way to everywhere. And as the question you asked about what happened between the first and the second wave, my view out of it is basically in the first wave, you know, we actually got the virus from abroad. So a pandemic started not in Israel, and you know, we all know that it started in Wuhan in China. So basically, people that were going out and coming in the country got the virus into the country. And people in the Arabic sector fought the virus because everyone in the world actually thought that 99% of the people will probably die from the virus. I'm telling you that we got people that tried to commit suicide, not to die from corona. They wanted to die something else. It was like a shame to get coronavirus infection. So, and this is amazing. You know, people were afraid to talk about it. And as for today, as what happened the first wave, you know, we fighted corona and we won corona. And what happened, it showed that even more than 70% of the population, the Arabic sector, the small villages, they didn't have even one infected patient. You know, Nazareth as a city, it's the largest city in the Arabic sector. We had just in 4 months, 19 cases from the city. And today we're talking about 1,700 cases in the second wave. So basically it's almost more than 1,000 times than we're talking about. So today, as for today, the main problem still is the regulation and people that don't cope with the regulation, because the thinking, the mind state of mind of 99% nothing will happen to me even if I get the virus. So that's a change of mindset. And this is the lousy thing that we go in. It become a belief that there is no corona. This is I believe or don't believe. How belief got into that, I don't know. But this is what happened actually, especially in the Arabic sector. People have this kind of mindset. There is no corona. It's a play. It's a political issue. Somebody, it's probably Netanyahu or even Trump or even somebody from China. It's a political, it's a governmental, maybe even industrial. All the manufacturers of the drugs are behind that. And this was the case here. We didn't get people that to admire or to admit that there is a virus and we can cope with it.
I want to get to the question about the role of medical professionals in affecting the discourse, but I want to table that so that we can get to your next question and then to Nidal's question, but I'll come back to this because I think what you're talking about is the lack of trust and belief. Doctors played a really important role in the community discourse and continue to. But I'm going to jump to a shared society question. You serve on national committees in the Ministry of Health and have written and spoken a lot about your hope that enhanced Jewish-Arab cooperation over the crisis will lead to lasting change in state-minority relations. What changes do you already see on the ground and in policy discussions as a result of the already heightened levels of cooperation?
This is actually a very important question. And I think this is the main issue that I feel as a personnel, as a leader here, as a medical director of a hospital. And again, serving of every committee that you can actually, state here. I met the Prime Minister of Israel, I met the Minister of Health, Minister of Finance, all the committees, the project manager. We have, what happened here in the virus here, I think, I see that the change in mindset of the Arabic society through looking at what you could, again, the tools that you could deal with this virus with the help of what we call the regulator, the country. the ministries, the Prime Minister office. People this time didn't fight this alone, didn't stand on the wall and said, you didn't give me, you can't give us, why we're hit by the virus. What happened, even the follow-up committee that supposedly the more like active in the political side, all the Arab MKs, all the leaders on the ground, you know, Nidal and others of the municipalities, understood the problems and came to the regulator and asked for closing the gaps. And this was the basics. At the beginning, even the first wave, the Ministry of Health didn't get translations for the regulation. So basically, we came and translated that. The Ministry of Health didn't have a project manager for the Arabic sector. Now there is. The Ministry of Health forgot about, you know, how to deal even socially wise and to understand what the Arabic sector needs. So the follow-up committee came with questions and answers and came to the officials and asked for that. You know, IDF, when we talk about the home front command, when you see soldiers that are actually going around cities, Arab cities, this was not a regular thing to see. Okay, in my hospital today, I have soldiers that work together with the physicians here in the hospital. And what I want to have, probably if this is a positive action of what's happening here, is to sustain this after the COVID is gone. And it will be gone, you know, hopefully soon. But one day we'll be behind COVID and talk about it as a past and history. And if we can sustain as a society, as an Israeli society in the Middle East here, we understand that when we have, you know, the mutual enemy this time, we can fight as a human being and look at each other as the same, you know, at the same time, same style, and we're fighting together. You know, the Arabic sector comes as one of each 4 paid people are working in hospitals. You know, 25% of the medical staff in hospitals in all Israel comes from the Arabic sector. So basically this time we were the soldiers. And this is the first time I told, you know, even the Minister of Defense, I told him, you know, you actually asked the Arab sector to join the army. And now it's not joining the army to fight, you know, politically, it's to fight a virus together. And so this is the basics of what's happening. At least I see that in my facility. I see that around. I see that in municipalities. I see the joint venture. Again, you know, political wise, you understand, Liron, and people that are hearing us, we didn't solve everything. You know, what we have today is a change of mindset of the tools that we're using to solve the problems, and not just say, okay, you know, this is your problem. No, it's our problem together.
And you see that on both sides within Arab society, and you see greater understanding among national leaders of the needs and willingness to adapt.
I totally agree. You know, people are today more practical of let's finish this now because it's killing everyone. It's killing us, them. And again, you know, when you look at it, in the first wave, we had, you know, 2 zones. Like we said we live in a country. This is 2 countries. You know, we have even 2 waves. It wasn't the same lines that we were. So basically, in all the first wave, 6 people just died in the Arabic sector. That's nothing. Okay, the virus wasn't there, but for sure there was separation between the countries. People didn't join, and we can see that when the second wave came in, we understand this is now an endemic. It's not a pandemic. It's inside the villages, the cities, and now it's merging everywhere in the country.
Thank you, Nidal. Now over to you. While much of the pandemic response on the public health side is on the medical front lines and national policy level, as Dr. Hakim is sharing with us, responsibility for implementing policies and enforcing guidelines and caring for residents takes place on the local level. In the first wave, as we said earlier, Tamra's local emergency response was turned into a model for other communities. Still, in the second wave, you became a red city. What were the major causes of the rise of infections in your eyes, and what have been the challenges facing even a well-prepared municipality such as yours in containing the spread? And maybe for starters, tell us what the lockdown looks like in your community today.
Okay, hi everyone. I will start with saying I will not do it fluently as Dr. Hakim did it. So I will try my best. So I want to start talking about the first wave as which is different in this crisis or emergency situation between this when talking about the epidemic and when talking about war. In wars, usually the Israeli government didn't consider the Arab community inside Israel as part of the community, as part of the state. And when there's a war, it's more political issues. And then usually they didn't also invest enough resource to prepare the different staffs in the municipalities, in the different levels, to be ready to face such huge, if it's war or other situation. And when it's epidemic, actually, and now talking not about a war, so we are as a community, as municipalities, also we are not ready to face, we don't have the enough knowledge, the enough experience as to face such say crisis or emergency situation. And when we were in the first wave, we know as community, as a municipality, municipalities, that we should organize ourselves. And we know that, as Dr. Hakim said, for example, we didn't have translated materials about what is going on, what is how it will hit us as community, as municipalities, local communities. And then we started as a community, as a minority inside Israel, to organize ourselves in the national level as a national minority. But in the same time also started to think how local municipalities, how municipalities should start to organize themselves. And us, as you told about Tamra as municipality, as 34,000 population in Tamra, a municipality that had a doctor in the head of the as a mayor. And then when it arrived to Tamra and we had the first 2 infections, actually there were 2 people who came from abroad, from Turkey, and they get it from there. And then when we started to organize ourselves, we said, when the central government didn't start to bring us the enough resource and let us be organized and how to face such, we should do it by ourselves. And that's how we started. Even when it didn't have so strong in the Arab community in the first wave, we were organized enough to face the first wave. Then when we arrived to the, and we should talk about the first wave as a monster. So when the different media and the different campaigns of the government talk about the epidemic as a monster, and when it didn't have us as a community, and we have for example, in Tamra we had 17 in the first wave, not more. Now we have a total we have 1,000. Today we have 270 active. The last week we had 370 active. Now we have 270 active. We have less, but in the first wave we have 17. So people didn't really saw the monster that they talked about, and it's not really a monster. It's usual infection, it's usual disease. And then the people, when we got to the second wave, people don't believe what the government are publishing, what they are talking about. As Dr. Hakim said, it's more political game, it's more, and also people believe in God. The most of the people believing that how we can say it, Dr. Hakim, that God already know what will happen, and even if we will start to try to face it, will not succeed. What was written will be in reality. And that's why people, because of the big monster that didn't arrive actually. People, and we got the wedding also in the season of weddings in the last 2 months, with no regulation from the police, enough regulation from the police, from the central government in the Arab community, in the Arab municipalities. Then we got more than 30%, or I think as positive from the test that was we did in the last 2 months. I think that was the percentage that we can talk about. And now when we as municipality know that we should control our life, we should be organized, but also when the central government know that it's not a war, we are not closed in our villages and towns. The integration and that the people going to their place to work and going out of their towns and villages, it will affect the whole places. It will not be still be inside the village or the municipality. Then they started to talk about the closing, actually closing, and try to figure how they can do it and how we can actually manage this crisis or this emergency situation together. So they started also to arrive and check with us from the also at the home, how we can call it, the home
command.
Yes. So we are working together with the commander of the home
command. The home front command.
We are working with the commander, but we as municipality, they know that we as municipality, we don't need the soldiers because we have our volunteers. We succeeded to recruit a lot, hundreds of volunteers from Tamra, which are up more than 18 age, and have them as in different groups to actually, when we maps the needs of our community, we figure that we have different groups of volunteers. We have medic, we have economic, we have people who can bring the foods to the families and to the elders. So we figure our situation, but we still have the very good relation with the commander of the home ID, how we call it. And when talking about how they deal with and why it's a high percentage or numbers of affections in the Arab community, is how they deal with, for example, the weddings. When talking about weddings, they closed the halls, and actually we didn't stop our weddings, celebrating weddings. So we take it from the halls, which is more organized, more can be regular by the police and by the owners of the halls, which is can be more organized, to our yards in our neighborhoods. And then we had there, and in the last 2 months, when we, for example, in Tamra had, for example, 30 or 40 weddings in 1 month or in 1 week.
Just to interrupt you for a second, a wedding is
people who are gathering together in the same yard, in small yard. Yes, Dr. Hakim, you wanted to add something, please.
No, Liron asked about that.
The wedding, it's not one, just to explain, to make clear, I think Dr. Hakim, you shared with me that even within Israel, there's not this understanding of what a wedding is.
Yeah. So basically what a major thing about when we look at pandemic or how infection goes, when you talk about wedding, it's not one-day event. We need to understand that a wedding in the Arabic sector, it goes for at least a week. It's a week or maybe 10 days sometimes. So a celebration happens every day. People are gathering every day, every night, eating, dancing, caring, kissing, hugging. So basically, it's if you're not getting the infection at Monday, you probably get it on Wednesday or Friday or Saturday or Sunday. So you're all the day behind that. And as a hospital director, I can assure you, we had some events that we got 60 to 70 infected people out of one day wedding. So that
And
basically
the national policy is restricted gatherings to some 20 or 50 people. And what you were saying is that this is not a policy that is well adapted to Arab
It was a mistake, I think. It was a mistake of such policy, which not considering the Arab culture, and if we'll still have the halls as to have the weddings there, actually we will not have these numbers of infections. That was our position. I think it's also the medical position. Maybe you can talk about.
The law was stating actually, basically Arab families are big families. You know, even if you're asking me to have a wedding, you know, I have 13 uncles and aunts from my father's side and 8 from my mother's side. So basically, just to gather this family, a small family, you know, as a concept, you're getting actually more than 20 people. And when your regulation is 20, you're actually, you know, forcing us to be violating the law. That was the case in the Arabic sector, and people started doing things at the backyard. And the problem in the backyard that the police cannot come force the problem at the backyard. So regulation, you can cope with it in the, you know, the big halls and areas. In the backyards of the homes, you need to come with the violence. That can happen. So basically, it was, again, we understand that this is a major mistake, but at the same time, now with the lockdown, at least we don't have this kind of gatherings.
Right, we don't have weddings now, and it's good that they close at least for this month, that we can start to manage the things and start as municipalities and the central government to manage the issue. Talking about lack of infrastructure in our community, in tens of years that didn't give the enough resource to have enough infrastructure in the education system and in the medical system also. We have the hospitals in Nazareth, but we don't have any another hospital in any Arab municipality. So we just have the hospitals in Nazareth, but we have the Triangles area, we have the Galil area also, that we don't have hospitals in the Arab community or in any another municipality. So we don't have the enough infrastructure to face such crisis, pandemic. So when it's arrived, and for example, we need to we decide to close our education system in our municipality before the government is decided to do that, because we know that when we started with the weddings, it also it's actually the same people going to work as teachers in the schools or to study, learn in the schools. And then when they take it from the weddings, they take it to the schools. And when the second level, we start to get a lot of infections in the schools. And then as municipality, we decided to close our schools before the central government decide about it. Because we know if we will continue have the schools will have hundreds of infections that will not be controlled in this time. And now talking about lack of infrastructure in different fields, I wish that the government and the central government now know when we have such emergency situation or epidemic, if they will not actually give the enough resource in the next years, and will have, for example, after 5 years such or 10 years such epidemic or another emergency situation, it will not be the same. Even I know as a community we are more organized because we have our national Arab organized committees in the medical level and in other also needs, but we're still part of the country, part of the state, and there's another needs that need to be given to the municipalities. For example, when after the first wave, when the government gave money for the municipalities, the whole Arab municipalities get the same budget as the municipality of Eilat, and municipality of Eilat are not more than 10% of the even it's 5% of the whole Arab municipalities, and they get the same budget as the whole Arab municipalities got in the after the first wave.
The emergency budgets were tied to the fact that the government gave a reprieve discounts to business taxes, allowing businesses not to have to pay their commercial taxes, which meant that localities weren't receiving commercial taxes. And because Arab society has very little income coming from commercial taxes because of few industrial zones, by virtue of the equation, some 2.3% of all of the emergency funding to compensate localities only went to Arab society. There was some negotiation about compensating for this gap, but even that fell short. It came out of future budgets that didn't exist.
We got a small budget more, but not enough to actually, because we don't have industrial zones in our villages and towns. We just have one maybe in Nazareth, and the other in Kfar Qasim, and the other more Arab municipalities don't have industrial zones. Then we will not get taxes. And when they actually talking about how to give the budgets according to how we got taxes before, we didn't get taxes, and now we didn't get the budgets.
So even though adapting the guidelines and enforcing them on the ground is very much falls on the municipality, there are very few resources. And I want to invite people to share their questions over chat. I see they're starting to come in, and while they're coming in, Nidal, one more question for you. Fahed, you'll have your. I have a question, and go ahead, Dr. Hakim.
No, I just want to elaborate on what Nidal said. You know, economically, it's very important when you talk about medical crisis. The medical crisis ones, where forced people. Even some of the people that were actually sharing with us, I'm okay to get the virus. I need to go to work. I'm okay to get infected because probably what the problem of the economics of the Arab sector, and again the government tried to enforce, and again to have a 922 all the situation of getting the budget to the Arab sector. But basically what Nidal was saying, and we saw that if you stop the education, even 30 or 40% of the children at home didn't have internet. So you can have telecommunications. You can have, if you send computer to everyone, you can't use it. If you have a family of 8 children, you can't just put one computer at home. They can't Zoom all together. Okay, if the mother is the teacher, she sits at home, she needs to teach. And what happens to the children? So it was a very, very heavy thing. Again, even in hospitals, we dealt with this because we saw that people didn't want to be admitted at hospital. They want to just go and work. They force themselves, even when they're sick, to go and find economy. Most of the Arab sector comes from small again, businesses. We don't have big companies here. We don't have people that have high-tech companies or cyber attack companies or whatever. So, but basically they come from finishing the month, and that's the case here. And so the economy here was very heavy in front of the medical side of it. And I see that what today needs to be happening is, again, giving more budget to the municipalities, giving more budget to the sectors, the Arab sector, even to go over this crisis. And I can assure you, even in the hospital, we find people that come even from the Jewish area. We have donations that come from abroad, people, very rich people that gave to the hospital because they saw that we're standing in front of the Arabic sector, and that was the case. And I like to share that because this is the time of mutual thinking. What we're doing today is actually putting we're putting the thinking together in a way of how to deal with this crisis together. So, but I wanna again assure Nidal what he's
we'll talk about it
coming from
a little bit more, But when you start to talk about the economy and how people are affected, the families. My wife is a teacher, And I know the ones who attended here in the Zoom or in the classroom system, they are not more than 30% of the pupils because of lacks of computers, internet infrastructure, and other needs that they don't have. And these gaps that we have now will be more in the future. We'll see it in the next 2 or 3 years when a lot of pupils lost such amounts of learning. So we'll find it in the next 2 years how they was affected with this period.
You're speaking to the issue of sustaining cooperation over, even when COVID goes, the public health emergency goes away, you have to sustain the cooperation because the
also in the economy, if talking about the economy sector in the Arab community, we have more than 96% of the business in Arab society are small, considered as small business. When talking about such small business, and when, for example, now we're closing the villages, they are closing the businesses. A small part of these businesses are still open, but the most of these businesses are closed, and it also will affect them. Such of them who are already invest in their business, they will need to return this money that they take from banks or from other places, and part of them will take money now, and they take, or we know that the first wave, small businesses take money from the, how we call it, the
black market.
Black markets.
Yeah, black market.
Yeah,
black market.
Criminal and black market.
Black market.
They will need to return this money also for those people. So our community, if we're talking about gaps now, the situation which will be after when we will pass this period of epidemic, the infections will continue be in our community, will be more criminal and violence in our community will be affected, and will continue have people who will be murdered for not returning money for the from where they got the money to continue with their small businesses.
So crime and violence violent crime is already a major issue in Arab society, and what you're seeing here is that the economic pressure, the fact that small businesses may not be eligible for government-backed loans or to have credit with the banks, means that they're going to, just to stay alive, they're strengthening the black market, which is going to exacerbate the levels of crime and be very, very dangerous. There's a question, are Arabs, from Phyllis Bernstein, hello Phyllis, are Arab citizens going to any of Jewish hospitals to get treatment? And do you see that hospital infrastructure will be developed near Arab municipalities as a result?
First of all, absolutely, yes. Today with the coronavirus, everyone goes to everywhere. I work at Rambam Hospital too, and still we see patients from everywhere. Tamra patients come to Rambam and come to everywhere in Haifa. There's no discrimination here. Patient is a patient. We get patients from Nahariya, from Acre, from even from Tel Aviv here, and the vice versa. We send patients to the mid of Israel. Today, Ministry of Health looks at it as a central admission, what they call it, tower, and they spread patients everywhere. We are actually called to be the busiest hospital in Israel as for today, from occupancy rates in COVID and in other, because the major problem here is not the non-COVID patients. When we deal with the COVID patient and we go back to the Arab sector, again, with all the medical problems that they hold, I can't just send people with the diabetes problems or heart attack because we don't have place to admit them. And this is one of the situations. And again, hospital infrastructure, I hope, municipalities, we work with municipalities to give support, but we can't as one facility give every support. And Nidal knows that, in the follow-up committee, we have a medical committee that works hard with all the municipalities to try and to find what are the major problems in the healthcare and in economics, and to try to joint venture here, go back to the regulator and get the budget maybe and the infrastructure or the techniques that are needed.
The issue now, Dr. Hakim, how we will pass this epidemic. We will pass it, and we will even this wave even will take another 1 year. So we will pass it, and we will have the damages which is inside this period. The issue is that all of us should work and to see how we will do after this epidemic, how we will deal with the damages after, which will continue, how we can affect the policy of the government that they should invest more to actually to finish these gaps or to have less gaps in between the Arab community and the Jewish community. How we'll have more hospitals, how they will support the existing hospitals more to give better service, medical service to the population. How they will, we should, as together, as Arab and youth in this country and also from the state, to think how we will bring them. Maybe we should think how we'll change the government. But if we will not change the government, how we can do it? How we can do what we should do in the next months, in the next year, that will bring them to understand that if epidemic can be back, and if they will not invest to have better community and better situation in our conditions in our community, it will affect the whole country. It will not affect just the Arab community inside Israel.
This is actually a perfect segue for a question about the broader context of the lockdown in Israel. From Allison, much of the discourse in Israel is focused on the political protests that are happening right now and whether they are a main source of infection. Arab society has not been part of the protest movement in large part. However, has the political discourse around the protests affected Arab attitudes towards the lockdown and towards the government policies in general?
Do you want to
Thank
start?
You want me? Okay. I can. First of all, it's very, very, very good question actually, and then basically when policy making, it's a major problem for the time being because it's coming from political side. And me as an advisor in a lot of committees, I can feel that, when you come with the medical advice, sometimes the political advice is very much more important here. And as you can imagine, we're focusing on the protests, okay, as basically against what the government is doing and basically against the Prime Minister himself. The Arabic sector is not a part of this protest, but what happens here is a kind of thing that I can call, you're becoming a patriot if you're now against the regulation. And this is something very weird and very, very actually we need to be afraid of. Because if you are as a citizen, understand if you go protest or find a way to go to, have a Rosh Hashanah, I call it protest at your family, this is kind of against the regulation. This is the kind of way, it's a Middle Eastern way, it's our Israeli way of doing, finding the way out of the regulation. But what happens in the Arab sector out of that is looking at as, okay, if I don't put a mask, I'm a patriot. I'm something against the regulation. I'm against what the government is looking at. I don't want to go, I want to have a wedding and invite people here. So basically it's something weird that's happening. And I think, the people that don't believe, again, coming back to the believers, as Nidal said, it's God's work. And with God's help, we will go over that. We believe in God's work, but not in the regulation, changing regulation. But I think now people are looking at us and saying, oh, see, they have protests, nothing happens. We need to have back our weddings, our things, our life. And what the major problem of the regulations here is they're not stating what to do. They're always not to do. No weddings, no gatherings, no prayers, no coming to swim. So basically, there are less things to give the people to go out, and to actually, live their lives under the regulations, not just forced. It's forced by the regulation.
But there's other reasons that I can add here for this. Actually, the Arab community, the Arab minority, Palestinian minority inside Israel, find herself in the last year as not relevant. When we goes as to elect our, and we participated in the last elections, and we have our representatives as 15 Knesset members, and they didn't want to have our support to have to change Netanyahu even, to change this government. And when they say that you are not relevant as Knesset members, now it's affecting how the people, in the Arab community will participate in another civil activity, when in the very clear civil activity as electing representatives for the Knesset and having a government, Israeli government, we wasn't relevant. So the same now, we think that we are not relevant. They want to change Netanyahu. They are demonstrating to change Netanyahu and his policy. But the ones who want to change him, they didn't thought that we are relevant. And now why and how we can be their partners? If a few months ago, we are not their partners and we are not as community relevant, how we can be relevant now to be a partners in demonstrations? Now, if the demonstrators, the organizer of the demonstrators will start to talk about the Arab community as a partner, as a relevant community, as about our representatives as a relevant for partnership in the future, the coming future, maybe the next year even. It's not so away from here. So maybe then the Arab community will start to think that they considering us as a partners, and then will actually can be part of these demonstrations. And now when we know that it's not, this demonstration is not affecting our life, because we believe also that the ones who want to exchange, to take Netanyahu out, they are not so different from him. That's also the people started to believe that the ones who want to change Netanyahu, they are not different, because when they are not even want our support to have their own government, how we can believe that they are different from the ones who are staying now in the government and leading the state? That's a very complicated, and it will be hard for us to bring the people to vote the next election. And when we talking about the next election, it's not far from now. Maybe it will be in the beginning of the next year. So we should people who are who think that it's very important that the Arab citizen of Israel should be part of the civil life of Israel, should think and should bring others to think about how we can from now think about the next election, how we can think about the next steps that which should be taken, and how we can bring people together. When physicians are working together in the hospitals, it should be a big campaign that we can use it to bring people feel that they are partners, that they are relevant, not just in hospitals when facing such epidemic, but also in the civil life.
I'm a little challenged how to follow that up. It's a big statement, and I want to and thank you both of you for your answers. I want to maybe ask. I know Phyllis had another question, and I want to ask you first before we go there about if you had to say what local leaders like you, Nidal, and medical professionals, Dr. Hakim, Nidal, you started speaking about this. What are the tools that you have right now? What could you do now to help deal with the immediate issue of reducing the numbers? Can you speak to that a little bit, and then we'll go to Phyllis's question about Ayman Odeh.
Well done, Dr. Hakim.
Okay. So basically, I'm just texting Ayman Odeh to see how he's feeling, because Phyllis is asking.
Thank you.
I hope he'll answer in a minute, so we'll get to his question again. Basically, the crisis is here. So I'm not a politician. I'm a medical professional. We're dealing with the crisis. We're in the middle of war. And I feel that what we need here is actually a leadership that we lack in several areas. We need people that to come to connect between leaders and between the regulator, to connect on the ground, again, with budget, with regulation, to give the Arabic sector the understanding, and again, go back to the word that is very important in this field is trust. The major problem is we have distrust as for today, as what Nidal have stated, is basically a distrust. You can't, Arabic sector lives on what we call concept of, trust, and don't accuse me of saying, give me the tools of helping. If I ask my son, why didn't you get an A+ in this test? And I actually didn't give him anything to study, not the time, not the tools, and even not the material. So you can't blame me. So basically today what we need, and I told that to the Minister of Health today, what the Arabic sector needs actually to look in the eyes of the people and say, join us to finish this war together. Join us, and I'm here, the Minister of Health, will help you go through that, because I'm here responsible of your lives, okay, economically and medically. We go over that together, and that together is this together is very important. You come with the problem and how you solve it, and we'll put the budget. In the lockdown, we're losing billions every day. So those billions were used even to give the budget to municipalities, to hospitals, to the sick funds, to everywhere. We won't be probably talking about it today. But again, I'm saying we're not talking about history now. We're in the middle of it. We're still in the middle of the crisis. And what I want today is cooperation. Cooperation and cooperation. People should be understanding we can't do it alone. I can't do it alone as a hospital director. I need the Ministry of Health here. I need the Prime Minister's office. I need people all over the world to help and to help together. The Arabic sector loves the family. Even the joint, we have something that we need to be proud of, is the love of our families. And what Nidal stated about coming back to school, this was the shift. I looked at it and I saw that patients that come to our facility were, again, the old people. When somebody dies, you say, oh, he's sick, he's old. But now when we got the youngsters that are getting sick, people are a little bit afraid now and back to the stream, back to the line. And this is the case from my side.
We have 1 more minute, Nidal, please. And if somebody can...
Cooperation and trust, the same in the local levels and in the municipalities, actually making more trust and connecting the people, try getting the people and try to get for everyone who were infected, and try to how to know how it will not get, he will not bring it to others. That's the way that we are trying to connect everyone personally by also calling them, talking to them, and also convince them to talk about their infection and how it's affecting people, how they're feeling about it. It's more to bring people back to believe that it's not a game. It's not a game. It should be faced by cooperation between all of all of us, all of who are willing to deal or to do anything. And that's the way how we are trying to do it in our municipality in Tamra. And we succeeded to have less infections in the last 2 or 3 days. We brush the health system to bring us more drive-in, to have more tests and high to check our population, and having more drive-in stations that we can have more tests and more information to the people, to the population, to control our life and not be more infected.
Thank you.
Ayman understands that he's okay, and thank you for the question, Alison. I also heard it. Phyllis, sorry. Back to course.
Thank you both. I think we have run out of time. We know you both have extremely busy schedules. This has been very, very insightful. I welcome anyone, if they want to ask more questions of our speakers, to send them to us at the task force, and we'll pass them along. We know there's a lot of work still to do. We're grateful for your leadership.
Thank you for task force. Thank you, people. I'm okay. I'll give back to course back. Thank you.
Thank you, everyone, for joining. This concludes our call for today, although I know we could have gone on for a lot longer. And thank you to Greater Washington Forum.
Stay safe. Love you all.